Gluteal muscle function depends on proper pelvic alignment and neuromuscular activation patterns. Today we're covering 3 progressive exercises addressing gluteal development through alignment, stability, and strength: pelvic reset in quadruped position, side plank with leg lift, and supported single-leg Romanian deadlift. These exercises target gluteal muscles systematically by first correcting pelvic positioning, then building lateral stability, finally developing comprehensive posterior chain strength. When practiced correctly and consistently, they can help improve gluteal activation, enhance hip stability, and support functional movement patterns. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have hip problems, lower back issues, balance disorders, or other health conditions. Understanding pelvic alignment and gluteal activation. Gluteal muscle activation depends on proper pelvic positioning and neuromuscular coordination. When pelvis is misaligned through anterior tilt, lateral rotation, or asymmetry, gluteal muscles, particularly gluteus medius and minimus, may not activate optimally during exercise. Common causes of pelvic misalignment include prolonged sitting creating postural adaptations, reduced lateral movement patterns, poor walking mechanics, and age-related postural changes. Consequences of pelvic misalignment affecting gluteal function include reduced gluteal muscle recruitment during exercises, compensatory loading in lower back and quadriceps, decreased hip stability affecting balance, and appearance of reduced gluteal fullness or hip dips. This 3-exercise progressive system addresses alignment first through pelvic reset, then stability through lateral strengthening, finally comprehensive strength through single-leg posterior chain work. Exercise 1. Pelvic reset in quadruped position. The first exercise is pelvic reset in quadruped position with crossover ankle addressing pelvic alignment. This foundational movement addresses pelvic positioning, creating optimal foundation for gluteal activation in subsequent exercises. Here's how to perform pelvic reset safely. Begin in tabletop position on hands and knees. Position hands directly under shoulders, knees under hips. Cross right ankle over left calf, creating gentle internal hip rotation. Maintain neutral spine throughout movement. Inhale through nose, preparing for movement. Exhale slowly while rocking hips backward toward heels. Keep spine neutral, don't round back excessively. Pause briefly at end range, feeling gentle stretch and positioning. Inhale while returning to starting tabletop position. That completes 1 repetition. Perform 30 smooth controlled repetitions per side. Complete 2 to 3 sets per side. Practice once or twice daily. Essential technique reminders: movement is slow and controlled, not rapid stretching. Keep weight balanced through arms, don't collapse chest. Breathe fully, coordinating breath with movement. Maintain neutral spine throughout, avoid excessive rounding. Keep crossed ankle position properly throughout set. This is neuromuscular reset, not intense stretch. Modifications: for wrist discomfort, perform on fists or use padding under hands. For knee sensitivity, use cushion or folded towel under knees. For limited hip mobility, reduce range of backward rocking. What to realistically expect: with regular practice once or twice daily over 2 to 4 weeks, you may notice improved pelvic awareness and positioning, enhanced ability to feel gluteal engagement, better hip mobility and internal rotation, improved foundation for subsequent gluteal exercises, and reduced compensatory patterns during movement. This reset creates optimal alignment for effective gluteal training. Exercise 2. Side plank with leg lift for lateral stability. The second exercise is side plank with leg lift, building gluteus medius and lateral hip stability. This exercise strengthens lateral hip stabilizers essential for pelvic control, balance, and proper gluteal function during daily activities. Here's how to perform side plank with leg lift safely. Lie on left side with left elbow directly under left shoulder. Stack legs or place top right foot slightly in front for balance. Engage core muscles and lift hips off floor into side plank position. Maintain straight body line from head to feet. While holding side plank position, slowly lift top right leg. Lift only as high as comfortable without twisting pelvis. Pause at top for 2 seconds. Lower leg with control. That completes 1 repetition. Perform 5 to 8 repetitions per side. Complete 1 to 2 sets per side initially. Rest between sets. Progress to 2 to 3 sets as strength improves. Practice 3 times per week. Critical form points: keep hips lifted throughout movement, don't let them sag. Maintain chest facing forward, avoid rolling backward. Lift leg only to height, maintaining proper pelvic alignment. Breathe deeply, exhale during leg lift, inhale during lowering. Keep body straight without excessive bending at waist. Modifications: for easier version, perform side plank with knees bent instead of legs straight. For limited strength, hold side plank position without leg lift initially. For progression, increase hold duration or repetitions once comfortable. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice strengthened gluteus medius and lateral hip muscles, improved pelvic stability during movement, enhanced balance and single leg control, better hip stability preventing knee collapse, and improved foundation for comprehensive gluteal strengthening. Lateral stability is essential for optimal gluteal function. Exercise 3, Supported Single-Leg Romanian Deadlift. The third exercise is Supported Single-Leg Romanian Deadlift, building comprehensive posterior chain strength. This advanced exercise develops all 3 gluteal muscles while training balance, hip stability, and functional movement patterns. Here's how to perform Supported Single-Leg RDL safely. Stand tall beside sturdy chair, table, or wall for light fingertip support. Shift weight onto right leg with soft knee bend. Left leg extend straight behind as counterbalance. Begin hip hinge movement, keeping spine long and pelvis level. Lower torso forward while left leg lifts behind you, creating relatively straight line from head through lifted leg. Go only as low as comfortable without rounding spine or twisting hips. Pause briefly at bottom position, feeling gluteal engagement. Engage glutes to return to standing in controlled motion. That completes 1 repetition on right leg. Perform 8 to 10 repetitions per leg. Complete 2 to 3 sets per leg. Rest between sets. Practice 3 times per week. Essential safety reminders: use light fingertip support on chair or wall throughout for balance. Keep hips square and level, don't allow rotation. Point back toe toward ground, maintaining leg alignment. Lead movement with heel driving back, not chest falling forward. Use gluteal muscles to return to standing, not lower back. Move slowly with control throughout. Modifications: for limited balance, use firmer support on chair with one or both hands. For reduced range, lower only to comfortable depth, maintaining proper form. For very limited capability, practice hip hinge pattern standing on both legs initially. For progression, reduce support gradually or increase range once confident. What to realistically expect: with regular practice 3 times per week over 10 to 12 weeks, you may notice comprehensive gluteal strengthening across all 3 muscles, improved posterior chain development, enhanced single-leg balance and stability, better functional hip hinge pattern for daily activities, and improved gluteal muscle tone and appearance for many. Single-Leg RDL is highly effective comprehensive posterior chain exercise. Progressive 3-step system approach. This system works through progressive phases. Phase 1, weeks 1 to 4, practice pelvic reset daily or twice daily. Perform 30 reps per side, 2 to 3 sets. Focus on pelvic awareness and alignment. May begin side plank holds without leg lift. Phase 2, weeks 4 to 8, continue pelvic reset several times weekly for maintenance. Add side plank with leg lift 3 times weekly. Begin with modified versions, progressing to full side plank with lift. May introduce supported single-leg RDL with significant support and reduced range. Phase 3, weeks 8 to 12 and beyond, maintain pelvic reset as needed for alignment. Continue side plank with leg lift for lateral stability. Emphasize supported single-leg RDL as primary gluteal strengthening. Progress range, reduce support, increase sets as appropriate. This progressive system ensures proper foundation before advancing to more challenging exercises. Importance of pelvic alignment for gluteal training. Proper pelvic alignment is foundational for effective gluteal muscle activation. When pelvis is misaligned, body compensates by shifting load away from gluteal muscles toward quadriceps, lower back, and other structures. This compensation pattern prevents optimal gluteal engagement even during appropriate strengthening exercises. Addressing alignment first through pelvic reset creates optimal positioning, allowing gluteal muscles to fire properly during subsequent training. Research suggests neuromuscular coordination and muscle recruitment patterns can be retrained through appropriate exercises addressing both alignment and activation. Essential safety considerations. These progressive gluteal exercises require appropriate caution. Stop any exercise causing sharp pain, significant joint discomfort, dizziness or balance loss, or excessive lower back strain. Consult healthcare provider before beginning if you have recent hip or lower back surgery, severe hip arthritis, significant balance disorders or frequent falls, or diagnosed pelvic or hip conditions. Always use appropriate support during single-leg exercises. Practice on non-slip surface. Start conservatively with modifications and progress gradually. Listen to your body always. Complementary practices for gluteal health. These exercises work best combined with regular varied physical activity, adequate protein intake supporting muscle maintenance, sufficient vitamin D supporting muscle function, quality sleep allowing recovery, avoiding prolonged sitting when possible, and regular walking maintaining general fitness. Address multiple factors for optimal results. Realistic expectations for gluteal development. Gluteal muscle changes require realistic expectations and consistent effort. Functional improvements including better hip stability, improved balance and movement control, enhanced posterior chain strength, and better movement patterns occur within 8 to 12 weeks for most. Aesthetic changes including improved muscle tone and appearance vary significantly individually. Some notice visible improvements with consistent training. Others experience significant functional gains with modest aesthetic changes. Both outcomes are valuable. Genetics, body composition, age-related factors, and training consistency all influence individual results. Focus on functional improvements supporting independence and daily activities rather than exclusively aesthetic outcomes. Monitoring progress. Track progress through functional improvements including easier single-leg balance, improved hip stability during daily movements, better control during bending and reaching, reduced hip or lower back discomfort for some, and enhanced confidence in movement capabilities. Exercise performance improvements including ability to progress from modified to standard versions, increased hold duration or repetitions, reduced support needs during single-leg RDL, and improved form quality. These markers indicate meaningful strength and coordination gains. When TOs seek professional help, consult healthcare provider or physical therapist if you experience persistent hip or pelvic pain during exercises, significant balance problems affecting safety, inability to perform even modified versions, no improvement after 12 weeks of consistent practice, or concerns about pelvic alignment issues. Physical therapist can provide personalized assessment, specific modifications, comprehensive program appropriate for your needs, and manual therapy if indicated. Conclusion: these 3 progressive exercises, pelvic reset in quadruped position, side plank with leg lift, and supported single-leg Romanian deadlift, provide systematic approach to gluteal development through alignment, stability, and strength. Pelvic reset addresses foundational alignment. Side plank builds lateral stability. Single-leg RDL develops comprehensive posterior chain strength. Start with pelvic reset, establishing proper foundation. Progress to lateral stability work. Advance to single-leg strengthening when appropriate. Practice consistently following progressive system. Use modifications as needed for safety. Maintain realistic expectations about individual outcomes. Combined with comprehensive fitness approach, proper nutrition, and healthy lifestyle, these exercises can improve gluteal function, enhance hip stability, and support continued functional capacity. Thank you for watching. For specific concerns about appropriate gluteal exercises or pelvic alignment issues, consult with physical therapist or healthcare provider for personalized assessment and guidance. Subscribe for evidence-based information on functional fitness and strength training for older adults, practical guidance prioritizing safety while helping you maintain muscle health and functional independence through effective progressive training.